One of the enduring mysteries in chronic pain research is why so many people, particularly older adults, experience persistent pain without any identifiable injury. These cases often confound both patients and clinicians. Imaging may reveal only mild degeneration, and standard anti-inflammatories provide limited relief. Yet the pain is real, debilitating, and often progressive. Recent discoveries in cellular biology are now offering a compelling explanation. Emerging evidence suggests that senescent cells, the dysfunctional zombie cells that accumulate with age, may directly sensitize nociceptors, the nerve fibers that detect pain, even in the absence of overt tissue damage. If true, this insight could revolutionize our understanding of age-related pain and open a pathway to novel, root-cause treatments. Senescent cells arise in tissues when cells are exposed to repeated stress, DNA damage, or inflammatory insults. Rather than dying off, these cells enter a state of permanent growth arrest. They no longer divide, but they don't stay silent. Instead, they secrete a wide range of pro-inflammatory and tissue-degrading molecules, collectively called the senescence-associated secretory phenotype, SASP. While originally an evolutionary mechanism for wound healing and tumor suppression, this response becomes harmful when prolonged. Chronic SASP exposure alters the cellular environment of tissues, turning them from regenerative zones into hotbeds of low-grade inflammation and degeneration. What's now being uncovered is that this secretory storm doesn't just affect the surrounding tissue, it interacts directly with the nervous system. Nociceptors, the specialized nerve endings that detect noxious stimuli, express receptors for many SASP components, including interleukin-6, IL-6, TNF-alpha, GM-CSF, and various chemokines. These inflammatory signals can lower the activation threshold of nociceptors, making them hypersensitive to even minor mechanical or thermal input. In other words, senescent cells can create a local microenvironment where the nerves are primed for pain, even when no new injury has occurred. Animal studies have made this link clearer. In aged mice or those exposed to senescence-inducing agents, investigators observe an increase in spontaneous pain behaviors and heightened sensitivity to light touch or mild pressure. When senolytic drugs are used to clear senescent cells from these animals, particularly from joints, spinal tissues, or skin, the hypersensitivity diminishes. This effect occurs even when there is no structural damage to reverse, suggesting that pain in these models is not due to tissue breakdown per se, but to neuroinflammatory sensitization driven by SASP exposure. This model of pain without injury has broad implications, particularly for conditions like fibromyalgia, chronic low back pain, temporomandibular joint dysfunction, and even some forms of headache, where traditional imaging often shows little or no abnormality. These syndromes are increasingly recognized as involving central sensitization, a state where pain circuits in the brain and spinal cord become hyperresponsive. But what initiates or sustains this sensitization? The chronic presence of senescent cells in peripheral tissues could serve as a constant low-level irritant to the nervous system, driving persistent afferent input and maintaining the central pain loop. Moreover, senescent cells may interfere with the natural resolution of pain. In young tissue, pain usually subsides as inflammation resolves and healing begins. But in the presence of SASP, the inflammatory signal persists, blocking regenerative processes and promoting a cycle of chronic activation. Additionally, some SASP components can recruit immune cells that further irritate nociceptors or degrade the extracellular matrix around nerves, destabilizing their environment. This would explain why pain can outlast the original injury and why it tends to increase with age, even in the absence of new trauma. This understanding gives new therapeutic urgency to senolytic and xenomorphic drug development. By either eliminating senescent cells or suppressing their inflammatory output, we may be able to restore a more quiescent, pain-free tissue environment. Early studies using compounds like Physidin, quercetin, or navitoclax suggest that this approach not only reduces systemic inflammation, but also improves physical function and pain-related behavior in animal models. If these findings translate to humans, we could be looking at a future where chronic pain is addressed not by dulling the nervous system, but by calming the cellular storm that agitates it. It also reframes how we think about aging itself. Pain has long been accepted as a normal part of growing older, something to be managed, not cured. But if senescent cells are a driver, rather than a byproduct, of age-related pain, then the problem becomes treatable. Pain without injury may not be a mystery or a psychosomatic event. It may be a molecular signal from a tissue environment corrupted by unresolved cellular stress. In this light, senescence becomes not just a marker of tissue aging, but a direct provocateur of neural dysfunction. And targeting it may allow us to rewire not only how we treat pain, but how we understand the experience of aging itself, less as an inevitable decline and more as a series of solvable biological problems, with sensitized nerves among the most urgent to address.